Welcome to the Single Best Answer series from the UCL Centre for Anaesthesia. Don't worry if you don't know the answer straight away. They're meant to stimulate your learning and develop your critical thinking. If you like, you can discuss the single best answers with an anaesthetist in theatre. Press pause now while you read the answers. Press play when you're ready to see the correct answer. So this question is about oxygen therapy and really kind of tests whether you've been around the ward or theatre and have seen different types of oxygen therapy in action. Okay, so option A, 80% oxygen. Well, that's the sort of thing we'd have for emergencies. So this isn't really an emergency scenario. So that A, I think, is not correct. Option B, 1 litre of oxygen per minute via a Hudson face mask. So the Hudson face masks, remember, are this clear face mask. They're not Venturi masks. They don't give a fixed percentage of oxygen. They're the ones that you would plug in. Well, everyone in recovery will be on, for example, the Hudson face mask. 1 litre of oxygen, that's pretty minimal. So, and it's not very precise. So again, that's sort of no, really. C, nasal tube to facilitate suction and encouraging coughing. Well, really, we're talking about a patient who's fully awake, who there's no suggestion that he's not able to cough, or that he needs any extra suction. D, 6 litres of oxygen via a nasal cannula. Well, nasal cannula, really, you can only go a few litres per minute because it's blowing oxygen into your nose, and that's pretty irritating. It's also very desiccating, very drying to the nose. So option D is not sensible. And E is a sensible option. 28% oxygen and reassess in 5 minutes. Let's see what the sats, 15 minutes, I'm sorry. Reassess in 15 minutes and see what the saturations are. Make sure that his respiratory rate and consciousness are the same, possibly improved. So option E is a sensible option. Note that you will use a Venturi mask, basically, so that is gives a fixed percentage of oxygen. You can find these on a lot of the wards, and they have different colours according to the different percentages of oxygen.